You know that feeling, right? You've got shoulder pain, you go get an MRI or an ultrasound, and then you have to wait for that report. You're just hoping for a clear answer. But what you get back is often, well, confusing, and honestly, it can be a little terrifying. It's just full of these medical terms that all seem to point to one thing. Something inside is broken. But is that really the whole story?
So the report comes back and it says you have a rotator cuff tear. Sounds pretty final, doesn't it? I mean, the picture shows a problem and you've got pain right in that spot. Seems like an open and shut case. But what if that picture, that image from the machine, isn't telling you everything you need to know?
For literally millions of people, this is the standard narrative. You feel pain, you get a scan, and surprise, surprise, the scan finds something. The story just seems to write itself from there.
Yeah, when you see words like tendinopathy or calcification or a partial thickness tear, it's just human nature to connect those dots directly to what you're feeling. It's the most logical conclusion, right? This thing on the scan is the reason I'm in pain.
But what if we just flip that whole script on its head? That's exactly what a group of researchers did in a massive review of the evidence. They decided to look not at people with shoulder pain, but at people who had absolutely none. And this right here, this is the million-dollar question they ask. I mean, think about it. If these so-called abnormalities are truly the cause of pain, then you really wouldn't expect to find them in people who feel perfectly fine, would you? Well, the answer is pretty fascinating.
And listen, they didn't just do one tiny little study. They conducted what's called a systematic review. That basically means they went out and gathered all the high-quality research on this specific topic, in this case, dozens of studies, to get the biggest, most complete picture possible. So the scale here is absolutely crucial. We're talking about 53 separate studies, covering thousands upon thousands of shoulders, from people who had zero pain, zero symptoms when they were scanned. This isn't just a fluke, it's a mountain of data.
And what that mountain of data showed, well, it's kind of shocking, to be honest. It completely challenges our whole idea of what's normal to see on a shoulder scan.
So what they find? A massive, massive range. When the researchers looked for rotator cuff abnormalities in all those pain-free shoulders, the results were all over the map, literally from 0% in some studies to a full 100% in others.
And we're not talking about minor little things here. These asymptomatic, perfectly working shoulders showed the exact same conditions that are so often blamed for causing severe pain. Things like full-thickness tears, partial thickness tears, tendinopathy, all of these were incredibly common findings in people with no symptoms whatsoever.
Okay, this slide just illustrates the whole problem perfectly. Let's just take full-thickness tears. So yeah, sure, they were found a bit more often in people who had pain, but look at that. So many people without pain had them too. There's this huge overlap, which means a scan, by itself, simply cannot tell you who's in pain and who isn't.
So, if it isn't pain, what's the one factor that consistently predicts whether these abnormalities are going to show up on your scan? Well, the answer is a whole lot simpler and, believe me, a lot less scary. It's age. Plain and simple, it's age. This chart, and this is straight from the study, shows it so clearly. As people get older, the chance of finding something on their shoulder scan just goes up and up and up. In fact, for every single year of life, the odds of having one of these abnormalities increases by 8%. Pain doesn't even enter the equation.
And hey, don't just take my word for it. The researchers themselves put it this way. They said that what they found supports the idea that what we're seeing is just age-related change. It's the result of a lifetime of using our shoulders.
This right here might be the most powerful way to reframe this entire thing. That rotator cuff tear on a scan in a 60-year-old, it might not be an injury in the way we usually think about it. It might just be the anatomical equivalent of getting gray hair or getting wrinkles. They're just wrinkles on the inside, a sign of a life well lived, not necessarily a sign of damage.
Okay, so let's get to the big takeaway here. What does all of this mean for you as a patient or for the doctors who are looking at these scans every day? Well, the implications are huge. First off, it means the picture often doesn't match the person's actual experience. This can lead to something called overdiagnosis, basically giving a scary-sounding label to a normal, age-related change. And that in turn can lead to a cascade of unnecessary injections, procedures, maybe even surgeries. And that's exactly why most clinical guidelines now say, hey, let's hold off on routine imaging for shoulder pain right away.
So if you do get an imaging report, how should you think about it? Well, first, just remember this explainer. These findings are super common and often don't mean much on their own. Second, remember that a scan is just one piece of a much bigger puzzle. It is not the final diagnosis. And third, and this is the most important part, focus on what really truly matters: your symptoms, your strength, and your ability to do the things you love. That's the real story.
And that really leaves us with this final, crucial question. It's so easy to get focused on a picture from a machine, on an image on a screen. But this research is just such a powerful reminder that we should always be treating the person, not just the picture.